Men's hormone replacement, we use BHRT, bioidentical hormone replacement, which we are essentially providing hormones that are no longer being produced, but want them at a normal level. This is not a level that is a very high super therapeutic level where a man is maybe taking anabolic steroids or a very large amount of testosterone. This is often a very small amount of hormone. Routinely, we would administer either a transdermal cream or an intramuscular injection. Initially, we would start with a patient with a complimentary consultation. We would obtain a complete history. We would also get laboratory values and then schedule a follow-up appointment. At that time, we would determine, based off of the laboratory values and patients' concerns, if it's appropriate for them to initiate BHRT. When you have a complimentary consultation with the patient, it is very important to get a very thorough personal history as well as family history. If you're administering hormones to a patient, you want to make sure that there's nothing that you're giving a patient that could potentially stimulate a breast cancer or could cause an adverse cardiovascular event. Hormones can cause adverse events if they're given inappropriately, so it's very important that you go to a physician who is well trained in hormone management. So when we look at men, yes, we want to look at their family history, but an elevated or a very low testosterone level doesn't mean that they're going to be predisposed to a testicular cancer or prostate cancer. We would just want to get some baseline levels and then possibly monitor the patient from there. One thing in men that we do want to make sure we avoid is very high levels of testosterone. It could cause high red blood cell levels where we would worry about hypercoagulation. We could also, if they're very highly androgenic and have very high testosterone levels, we could worry also about an adverse cardiovascular event. For our male BHRT, we offer a treatment that best suits the patient. We have some patients that continue to come in weekly for injectable treatments. We have other patients that are on transdermal treatments that are applying them daily. We have many patients, we can teach them how to do an injectable at home and they're administering them at home. We will customize the patient's treatment to suit their needs and their comfort. Once your hormones are deficient, there is no way that they will start being produced again. So once you're receiving exogenous hormones, usually that is lifelong unless there's some very particular reason that it would be adverse. So consider it like having high blood pressure or diabetes. Once you have high blood pressure and diabetes, likely you will be on those medications lifelong unless you have some major life change. But even men in their late 20s, they start to decrease their testosterone level by about 1 to 2% a year. So usually by the time they're in sometimes even their late 30s, but 40s and 50s, their testosterone level is much lower than when they were in their 20s, and they often have symptoms from that. We want men to feel like they're producing the same amount of testosterone as they were when they were younger.